The next mini lecture is on subconjunctival hemorrhage as well as pterygium. And these are also two common things that you're going to see in primary care, although the pterygium may not be as common as the subconjunctival hemorrhage. And what this is really, it is a bright red patch appearing in the white of the eye, and there's a thin layer of clear tissue, which is called the bulbular conjunctiva. And when a subconjunctival hemorrhage occurs, there's a small blood vessel that breaks open and bleeds within that conjunctiva. So the blood with, from that broken blood vessel is often very visible, but since it's confined within the conjunctiva, it doesn't move and you can't wipe it away and it's not going to come out of the eye. It's usually not associated with any type of eye injury at all. But it's usually noticed when you wake up in the morning and you go to look in the mirror and you see that this is there. So it can happen in any age group. It's very spontaneous. It happens a lot when people cough. It happens a lot when people sneeze or vomit, or when they're straining on the toilet, when they have a Valsalva maneuver. So, those are some of the reasons that it occurs. It also can occur because of high blood pressure or taking blood thinners. So you need to be cautious of that too when you're looking at a patient with subconjunctival hemorrhage, and be looking at their medications and maybe needing to check if they haven't had a PT done, with an INR. Rubbing of the eyes can also cause it, as well as a viral infection could cause it. So if the patient comes in like this, and if they say to you, well, I did have some type of injury to my eye, then this is probably not a subconjunctival hemorrhage, and they probably need immediate ophthalmology referral. So that is really nothing that you want to play around with. So you want to be very cautious in regards to, looking at it. These are some really good pictures of the subconjunctival hemorrhage. I tried to get one that was a partial, one that was full blown, and one that was very small. Now you can see this one here on the top right. Looks like there's some ecchymotic areas going around in the periorbital area, so I'm not sure if that was just taken because of an injury or not, but at least you get a good picture of what that looks like. So when you're doing your history of present illness, it's really important to ask them when it happened, how long it's occurred, if there was any trauma. If there was trauma, you immediately refer them. How did it occur? Were you coughing? Were you sneezing? Were you straining with the bowel movement? Have you been constipated? Did you have any have your blood pressure been high in the past? Do you have high blood pressure? Is there any type of discharge? Do you have any eye pain? And then you're going to go into your review of systems. Do you wear contact lenses? What kind of medical history do you have? Are you taking anticoagulants? Are you in atrial fibrillation and you're on anticoagulants? What kind of medications is going to be very important, because some of the elderly patients that come in don't realize, and may not tell you that they're on these medications. So you need to go back and look at the medical history. If if you're really not sure and they're not giving you the good information, they're poor historians. So the treatment plan is really very simple. There is no treatment. It's usually self-resolving. The patient will need to be reassured that this is definitely a benign condition and that there isn't anything that they can do to get it to resolve on their own. It just has to just run its course. Compresses, sometimes you could use them, but they really don't help very much. So they're not really used. But just explaining to them that we know this looks ugly, this isn't going to be something that's going to be there for a long time. About 1 to 2 weeks, you should start seeing where your eye starts to go from the blood to a yellow color, and that's when the healing process is occurring. And next we're going to look at pterygium. And a pterygium is a conjunctival degeneration, and it results in an opacity that partially covers the cornea. And you most of the time will see it at the 3 o'clock position or the 9 o'clock position. And it is slow growing. the opacity may eventually obstruct the vision. So it's mostly commonly seen in someone who's had excessive exposure to ultraviolet light, or if they've been in dusty surroundings or windy conditions. So it's a wing-shaped fibrovascular conjunctival tissue growth, and it encroaches on the cornea. The treatment for this includes artificial tears. That's really about the only thing that you can do for it. It does not usually require any medication treatment or any antibiotics or anything like that if the symptoms are mild. So you can use lubricating eye drops or ointments such as Blink or Refresh to alleviate the irritation. And then wearing protective eye cover should be worn, when somebody's outside. Occasionally, they may use some vasoconstrictor drops such as Nafcon or a short course of steroid eye drops such as FML or Lotamax, but usually it will just go without treatment. If the lesion does persist and it starts to interfere with the vision, then you do need to send for surgical removal of the opacity, and that would be done by an ophthalmologist and an outpatient procedure. And this gives you a really good picture of a pterygium. You can see how it's starting. It's at the 3 o'clock position and the 9 o'clock position, and it's encroaching in, so the patient's vision is obscured, most likely in the left picture, and then in the right side, it will start to partially be obscured. And these are fairly common that you'll see in primary care practice.